Tamara Thomas, editor-in-chief of UrbanHealthToday.com, part of the DocWire family of medical news sites, and I want to thank you for tuning in to Urban Health Weekly. Our goal each week is to keep you informed of the latest in health and medical news right from today's headlines. It's time to empower yourself with open conversations about your medical care with news that matters to you. So are you ready? Let's get started. Hi, I'm Tamara Thomas, and welcome to Urban Health Weekly. I'm here with my friends Jackie and Lou, and how are you guys?
Good. How are you guys doing?
I'm all right. What about you, Lou?
I'm all good. Too eager? Did that sound too eager?
No, it sounded like there was like a delay, like you were waiting for something special to happen. That's I'm wondering what that was.
Well, it's not my birthday, so you know. Right.
Oh, you know what? I started watching this weird show on, I think it's HBO Max. It's with John Cena. It's this new show. He's a superhero. Peacemaker. Thank you. It's a weird show. It continues off the movie, The Suicide Squad, which, by the way, I thought this Suicide Squad movie was much better than the original Suicide Squad movie. This one was with Idris Elba. The original one was with Will Smith. I like this one a lot better. It was just more gratuitous violence, which I find entertaining.
You enjoy?
I do, because
oh no, you got to tell me how many decapitations are in that movie, because I have a thing. I don't like movies with decapitations, and there are a lot of them lately.
No, I mean, I don't like it to that degree of like,
okay.
I want to see some heads roll and that kind of stuff. I just like the action sequences because it moves so quickly and it's so matter of fact the way they do it. It's not like drawn out and tortured. It's like part of the yeah. So I like the hand-to-hand combat of it. That's really more what I like. Anyway, so on the show, the two women made an interesting point. So this was in the show, The Peacemaker. So one of the characters, she's got little dogs. And she was talking about how one of her little dogs enjoys getting dressed up. And the other woman's like, no, he doesn't enjoy getting dressed up. And she's like, yes, he does. He perks up when he puts on a little outfit. And so she says to her, well, do you pet him more when he has the outfit on? And she says, yes. She said, he doesn't like wearing the clothes. He just likes humiliating himself for your affection. So when I thought about it, I was like, I always thought that my dog, because I have two dogs, Chewy and Coco. And I always thought that Chewy liked getting groomed because he felt spiffy and all that other stuff. And now I'm starting to realize that maybe it's not about maybe he doesn't really care how he looks or anything. Maybe he's reacting to my reaction to him because I tend to put him on my lap more and snuggle him more when he's like all shaven and clean. So now I feel guilty. I feel bad that I treat my dog differently when he's all clean and cut.
Oh, your love is not, it's a little conditional.
Yeah, I guess so. I'm guilty as charged. I was about to try to deny it, but it's true. I'm ashamed to say. So I'm going to start trying to make a more concerted effort to bathe him. I do it in the summertime, but in the wintertime, it's just so darn cold and they're so little. They're like, 6 pounds a piece. But I'm going to have to do it because that's not fair to him that he has to.
You don't just take them in the shower or bathe them in the sink?
I do bathe them in the sink. It's just that it's just been so cold. I haven't even wanted to take their clothes off of them. And then what happened was with everything closing, their appointment just kept getting pushed back because, everyone came.
Oh, yeah. Everybody got ill.
And he was just getting really antsy and anxious. And I was like, slow down, guy. Don't worry. You'll get groomed soon. But I really thought it was because he enjoys the grooming process. It didn't occur to me that maybe he enjoys the grooming because of what it means when he gets back home. Anyway, so let's get into the show. We got a lot to talk about today. Very interesting topic. We're going to be talking about Medicare, Aduhelm, and Alzheimer's equity. But first, let's start off with strongest evidence yet that multiple sclerosis is caused by Epstein-Barr virus. It has long been suspected that the common Epstein-Barr virus, why anyone would call that common, I don't know, but the common Epstein-Barr virus can trigger multiple sclerosis. Now, a study of 10 million military personnel in the US has shown that virtually every case of MS is preceded by infection with the virus. The findings suggest a vaccine against the Epstein-Barr virus could greatly reduce the incidence of MS. MS is caused by the immune system attacking the protective sheath called the myelin sheath that wraps around nerves, leading to symptoms such as difficulty walking that worsen over time. The Epstein-Barr virus is a kind of herpes virus that spreads mainly via saliva, for instance, by kissing or drinking from the same glass. It's the cause of mononucleosis, sometimes known as glandular fever. Initial infections may cause few, if any, symptoms, but once the virus gets into immune cells called B cells, it lurks in them permanently. It can reactivate and cause issues later in life, including various cancers. The difficulty with demonstrating that the Epstein-Barr virus is the main cause of MS is that 9 in 10 people worldwide is infected with it. That means scientists must monitor huge numbers of people to find out whether people who haven't been infected with the virus are less likely to develop MS. If this is true for even just the MS cases caused by Epstein-Barr, this is a cause for celebration because that means that the majority of suffering could be alleviated someday with a vaccine. You know, my aunt died of MS when I was a kid.
Oh, wow.
Yeah, she was very young. She wasn't even 30. And she was swollen. I remember her face was swollen. She always had a beautiful angular face, and she was very swollen. And I remember as a kid trying to sit in her lap, like I always did. And I remember she winced in pain, and I just shut up immediately. So
wow,
it's a devastating disease. By the way, did you know that a protein in the Epstein-Barr virus produces attachments to locations in the human genome? And it's associated with 6 other autoimmune conditions besides multiple sclerosis, rheumatoid arthritis, juvenile idiopathic arthritis, SLE, celiac disease, diabetes, and inflammatory bowel disease.
I think it's also possibly associated with fibromyalgia. You hear that a lot, maybe or maybe not.
Makes sense. Yes.
I think they call it the common Epstein-Barr because it's so common, I think, with that many people. I don't know anybody who hasn't experienced Epstein-Barr at some point in their life. I mean, it pops up all the time.
Yeah. Well, there's a book called Cancer Virus, the story of Epstein-Barr virus, and it gets really deep into how destructive the virus is. I guess that's why the term common for me was just what do you mean common? It's anything but I know what you mean when you say common, so many people have. Yeah.
Right. That must be why they say common. That's what I'm thinking.
Oh, okay.
I want to say Epstein-Barr. Is that EBV?
EBV.
Or EBV6? I forget which one it is. It's associated with Burkitt's lymphoma too. And
yes. Yeah, I read that. I read that as well. Yes. And I read that data from the book that the cancer virus, was instrumental in helping to create vaccine programs in Africa and, for the disease. That's crazy.
Well, I guess it's going to be sort of are they anticipating that it's going to be like the HPV vaccine?
I hope so, that it's prophylactic. Yes, I hope so.
Well, you better give it to people so quick.
Well, that's the thing. They've got to start really young.
When do you get it? Because a lot of people get it just as little kids.
Right, exactly.
It's less so like HPV vaccine. They give it around 9 or 10. They give it around there before
they give
a child.
It in the teens. My feeling is that any disease or any virus that's going to lead to cancer, I think inoculation as early as possible should be part of the vaccine schedule.
I would think the Epstein-Barr virus vaccine, that would have to be very early because Epstein-Barr is everywhere. I mean, it's out there. I don't see, I don't know, if you get it with
something simple, sharing a glass of water. Yeah, I know.
Right.
I don't know. Maybe it should be part of the early, but I don't know. But that depends on, if a very young immune system can handle it.
Right.
I mean, maybe it should be an age 5 thing where before you start, a school setting or before you start a pre-K setting that you get that.
That's a lot of vaccines before school age, man. There's so many out there. You got to get a lot for your kid for school.
But if it means that you're going to head off multiple sclerosis and now less suffering that comes with that, I'll take it.
I made a decision on the HPV vaccine for my one. Yeah. I made that decision. Yeah.
So you're gonna do it.
I already did it for him.
Yeah. Oh, awesome.
Yeah. Well, now they recommend it, for both sexes, or, for boys and girls and everybody, all kids, they recommend it for.
Wow.
Yeah.
I hope that this is, coming sooner than later, because this is a devastating, reading about all of this stuff. This is a devastating virus. Speaking of IBD, is there a link between IBD and microplastics? In a new small-scale study, researchers have found an association between inflammatory bowel disease and greater amounts of microplastics in stool. The findings appear in the journal Environmental Science and Technology. In the studies, researchers wanted to see whether there was an association between microplastics and IBD. People are exposed to microplastics throughout their lives, although the effects on health are not yet clear. Dr. Maria Neira, Director of Public Health, Environment, and Social Determinants of Health at the World Health Organization, or WHO, says that we urgently need to know more about the health impact of microplastics because they are everywhere, including in our drinking water. Based on the limited information we have, microplastics in drinking water don't appear to pose a health risk at current levels, but we need to find out more. We also need to stop the rise in plastic pollution worldwide. Dr. Yan Zhang is the corresponding author of the present study. He works in the State Key Laboratory of Pollution Control and Resource Reuse at the School of Environment at Nanjing University in China. And he previously found that in animal models, microplastics accumulate in the liver, kidney, and gut. He also found that this accumulation was strongly dependent on the microplastics particle size. The researcher explained to Medical News Today that compelling evidence shows that microplastics mainly accumulate in the gut of various species and cause intestinal inflammation and metabolic disruption. They found that the participants with IBD had significantly more microplastics in their feces than the healthy group. Now, just to be clear, the study does not demonstrate that microplastics cause IBD. Dr. Zhang says it is difficult to say that microplastics contribute to causing IBD because IBD is a very complex systemic disease and its etiology is not clear. We prefer to believe that people with IBD are more likely to retain microplastics. Well, this isn't great news because 94% of tap water in the US is contaminated with microplastics. Even filtered water has its fair share. And
so like those the ones that you do from your sink, you have like a dispenser, you have like a pitcher and it filters that out.
It depends on the quality of the filter, but I don't know that it's 100%. Even 93% of bottled water contains microplastics.
Well, first of all, bottled water is not bottled water. Bottled water is plastic. So, obviously, it could be contaminated with plastic because you're drinking it out of plastic.
But they're talking about microplastics like existing in the water.
Oh, you're not saying like the plastic bottles are shedding the plastic.
No, that's not. We're not talking about leaching. We're talking about just the microplastics that are.
So microplastics that have gone into the waterways.
Right.
And
exactly.
Are not getting filtered. Oh.
Yeah. And and these are endocrine disruptors. People may think, oh, what's the big deal? It's a little bit of plastic. My liver will take care of it. Well, these are endocrine disruptors. And that means that they interfere with the normal function of your hormones. And I'm not sure people realize how important and how central your hormonal system is to your body. I mean, this controls everything from eating and sleeping to having sex and making babies. Like, everything, hormones control everything in your body. And if that gets messed up, you have a whole world of health problems.
And not only that, it seems like every day almost there's some new hormone that is discovered that has new importance. And all your like established, like the liver, the thyroid, like the ovaries, they make more hormones and new hormones that we haven't even discovered yet that are important. It's crazy. You don't want to disrupt your hormones.
No, exactly. And it's very difficult to say because most people rely on tap water. But the only thing I could say in my very non-professional, let me say it again, non-professional opinion is to stock up on activated charcoal.
Activated charcoal?
Activated charcoal. According to an article I read on PubMed, activated charcoal has been shown to reduce microplastics from water. And let me tell you, if you put some,
I think some of those filters, the like.
Well, that's the thing. If you have
those are activated charcoal.
With activated charcoal, but it has to be enough of it, and I'm not sure.
Oh, that's not a lot in those things. Like the pitcher I have with the filter system.
It's got to have a very high amount of the activated charcoal. But you could also just add a teaspoon of activated charcoal to your water. I know it's disgusting. It sounds.
Oh, that was old school. When I was a kid living in Europe, I remember in France they would give us like activated charcoals.
Yes, you know, and it just helps your liver to clear.
It made your tongue black.
Yes, but temporarily. But it drew all of that stuff. Like I remember after I had my colonoscopy, I was really not feeling well. I was having a reaction to the anesthesia, the twilight and stuff. And that was just twilight. It wasn't like even full on anesthesia.
Right.
But I was really sick afterwards. And then I started drinking activated charcoal and I was fine.
Where did you get that? Where'd you get activated charcoal at?
I got it at a health food store. It's not that expensive. It comes in like a little jar. It's not expensive to produce, but oh my gosh, it really does. You know that David Osprey guy, the bulletproof coffee guy? He talks about it. He's always talking about it. He's like, oh, you know, I had a cookie and then I had some
Oh, he thinks he can undo the sugar with activated charcoal?
Because the less of that stuff that's going through your liver is the better for you. Because what happens?
Does he take an aspirin while he drinks? Does he drink alcohol and take an aspirin at the same time? Does he do it that way too?
I don't know. I can't say. I'm just talking about the activated charcoal. I'm not.
But with the microplastics, if you know how like they say, like if you have a bottle of water and then the water freezes, you should especially not drink that bottle.
If it freezes or if it's left out in the sun. There was a singer who had actually gotten throat cancer by leaving her water bottles in the car and it got hot and she would drink it afterwards. Anytime that ever happens, I just throw it out.
Is that, do you think that's microplastics or that's separate? That's not.
Well, it's leaching. It's leaching. So
leaching, right.
Leaching, which is a little bit different than microplastics, but it's the same effect. You're still getting plastics into your system. And those plastics are endocrine disruptors. So you want to try.
So do you think those microplastics, are they like from BPA or who knows what? Because there's more than just
there's BPA. Another one. There's BPA, but a lot of bottled companies have done away with the BPA. I forgot what the other one is called. It's It is
an alternative to BPA to get away from BPA.
Right. Exactly. It's another B phenol, but I can't remember the name of it. I'd have to look that up and look at the article. But I don't want to like spend time on that. But yes, it's another BP. I just can't remember what that particular BP is, but it's not BPA, but it's still harmful.
Activated charcoal, filter your water.
Filter your water as much as you can. Try not to drink tap water. Like when I go out to restaurants and they say, oh, do you want still or tap? I just have none because I just probably recommend just not drinking it. Did you hear the horrible story, by the way, about the man who I forgot what chain restaurant it was. It was a Cracker Barrel, I think. And he thought he was drinking a glass of water and it was like a glass of chemicals and it burned his esophagus.
Oh my God. How did that happen?
I don't think it was an accident for someone to give him an entire glass of chemical. I think he must have pissed someone off or someone must have been in a foul mood and decided to take it out on a customer. And anyway, that happened a few years ago and he still has health problems as a result. And the jury finally awarded him like a whopping multi-million-dollar settlement. But it was like some cleaning solution that someone poured into the glass and gave him. And, most people, when they get the water on the table, they don't give it a thought. They just knock it back. And so that's what he did. And it which is totally unrelated. I was just
you digress.
With drinking water from restaurants, which I don't recommend, but I know most people do it. I know Lou does that all the time, drinks.
I was doing that. So if they offer bottled water, like a pitcher of water,
offering bottled water. I got a feeling that they just fill those.
I've always thought that too. They just fill that up with the tap also.
Yeah, it's not like they put smart water in it.
Yeah, I just as a habit just don't drink it because I don't know where it's coming from. If I haven't poured the water myself or I haven't picked it up in the supermarket, I'm not going to consume it. So do we have time for the next one, Lou, or do we take a break?
I think we should take a break.
All right. We'll take a break and then we'll come back. On to less depressing news. Could an Army vaccine be a game changer against all future coronaviruses? Skyrocketing COVID-19 cases have many experts talking about yearly boosters or variant-specific vaccines. But what if there were an adaptable, universal coronavirus vaccine that could fight any COVID variant or even any future coronavirus? That's exactly what the U.S. Army is developing right now. White House Chief Medical Advisor Dr. Anthony Fauci recently touted the importance of a universal vaccine to protect against all COVID variants. In an interview with NBC, Fauci said a universal COVID vaccine would mean that the initial vaccination would cover all of these little variants, so you wouldn't have to worry. We want a pan-coronavirus vaccine so that you have it on the shelf to respond to the next level pandemic, Fauci said. Ultimately, you want to get a vaccine that covers everything. In December, the U.S. Army announced that its pan-coronavirus vaccine, the spike ferritin nanoparticle COVID-19 vaccine, SPFN for short, had completed phase 1 of human trials with positive results. Dr. Kayvon Majarid, director of infectious disease at Walter Reed Army Institute of Research and co-inventor of SPFN, told Defense One, "We're testing our vaccine against all the different variants, including Omicron, the strain causing breakthrough infections, even in people who have received booster shots. SPFN still needs to undergo phase 2 and 3 human trials, though, to test its efficacy and safety in comparison to current treatments," Majarad said. We're going to keep our eyes peeled for more developments on that front. I just want to know where to sign up. Where do I sign up? Because I want off this roller coaster. Because if this pans out, then we can finally truly get back to it. And maybe more people will jump on board, maybe because it's just one shot as opposed to
just one shot. I have heard people say they're annoyed that we might be having to get boosters every 6 months. Like,
it is an annoying thought. It is an annoying, particularly because it's so hard to get the shots. And who the hell has the time to do this every 6 months? Like, I get my flu shot every year. And even that's like, well, no, it's not as much a pain because it's very, you can get it very easily. It's not like a shortage. You don't have like, people piling up for it. So it's very easy to get. But I'd like for it to become like that if this doesn't pan out. But if this pans out and you just one and done, baby.
I didn't even realize that they had the wherewithal to have that kind of ambition to come up with. I didn't know that it was doable. That's impressive.
That is very impressive. But I think we're at a time now where the government wants to take some control away from private industry. Louis, do you want to jump in on this? That's what it feels like to me. I mean, it's a good thing, but, I wonder what that's going to do.
It's a good thing in theory, but I think number one is how they used to say it, you know what you know, but you don't know what you don't know. So, okay, it works against all existing variants and anything we can dream up of. But if the number of unvaccinated people remains the same and this thing keeps going through the washing machine of viruses, we don't know what's going to develop from this thing 3, 4, 5 years from now. And will this vaccine be effective against it? And the other thing is that, our definition of effective vaccination kind of varies. What they're saying now is, and which is fine with me, is that effective vaccination means that once you take the vaccine, even if you get infected with COVID, you're not going to get sick, which is what's happening in a lot of cases, or seriously sick, which I'll take, in terms of where we're going. So that whole definition, because then you get knuckleheads on social media and TV that revel at talking about all the people that are infected with COVID that took the vaccine, yada, yada, yada. Yeah. But most of those people come back and live. People that didn't have the vaccine
are the ones piling up in the hospitals.
In the hospitals are dead. That's kind of, there's a lot to be said there. And cautious optimism is what I'm doing.
It seems almost unbelievable, though, that they might be at the point of that Fauci is thinking that that's doable. We haven't had it for the flu. it's a little mind-blowing. Is that really around the corner in some capacity? I'm amazed that's already made, it's already in phase 1 trials.
Well, we've developed enough data on this, and we sort of know and also mRNA it's not like it's difficult to make. If it's mRNA based, I don't know. But I can't imagine that with all the data given and all the multiple ways that this is. I mean, look, Cuba has 3 different vaccines for the coronavirus that have proven very successful, have beaten it back, and they're giving it to other third world countries. So,
wow. So it's also like everybody getting behind this instead of it just being a case of pharmaceutical profit R&D.
It's about, the power doesn't stay up there with the Pfizers and Modernas and the BioNTechs of the world. It's becoming like everyone is affected by this, and everyone who has a science is trying to see what they can do to add to the pot.
Yeah. Well, look, of course I'm going to defend pharma. So,
yes.
All I got to say is that
you always do.
Pharma has the ability, and private industry has the ability to move very quickly, which they did, a lot quicker than the government. Now that
this sounds pretty quick to me, though.
Okay, now
phase
that we're
1,
okay,
and we didn't even know about it.
But imagine how much death was saved. This thing is going into year 3 now. Imagine how much.
Oh my God! I wish people would stop saying that. This is only year 2. We've just completed. March will be. Well, technically, if you go back to 2019, then this is 2 years. There's only 12 months in a year. I can't stand when people say, "Oh, our 3rd year." No, this is not our 3rd year of this. We've only been dealing with this for 2 years, and that's still a lot. But it's not 3 years. Stop exaggerating.
Well, number one,
I'm not saying you're exaggerating. I'm saying in general, people exaggerating saying 3rd year.
When we say government is piggybacking on research that was done by pharma. Number one. Okay, number 2.
Who cares?
Oh, haven't we had this discussion before?
Yeah.
Pharma is also benefited from
government subsidies.
Exactly. To research. Yeah.
Thank you.
Look, it's a lot easier. It's a lot easier to modify a car than it is to invent the car. Okay, and you're taking things that have been perfected, taking those technologies and moving them forward.
If that's what they're actually doing, we don't know what the basis of their vaccine is. I'm assuming it's mRNA. I don't know that for a fact. None of us know because they haven't said.
Yeah. So,
but we'll definitely be keeping an eye on this.
I'll take it. It's good. It's timely. Let's hope. I mean, I'm rooting for it. That's what I got to say.
All right. I want you to know that I am available for testing.
Human trials.
I'm available for phase 2.
Phase 2 and phase
trials.
3.
That's right. Sign me up. That's all I have to say. All right. On to this week's topic: disparities in Alzheimer's diagnosis and treatment. Now, here's the deal. So first, let me set the stage with this. For the estimated, this is from AARP. For the estimated 6 million older Americans living with Alzheimer's disease, race and ethnicity are a barrier to quality medical care, according to a new report from the Alzheimer's Association. The special report on race, ethnicity, and Alzheimer's in America found that 66% of Black Americans believe it would be hard for them to get what they perceive as excellent care for the brain disease. That view is shared by 40% of Native Americans, 39% of Hispanics, and 34% of Asian Americans. All were also likely to distrust medical research and unlikely to believe healthcare professionals empathize with them.
Wow.
Clearly, I know, right? Clearly, discrimination, lack of diversity among healthcare professionals, and mistrust in medical research create significant barriers to care and demand the country's full attention, said Carl V. Hill, PhD, MPH, Chief Diversity, Equity, and Inclusion Officer of the Alzheimer's Association, in a statement. Regardless of race or ethnicity, survey respondents see affordability as the most likely barrier to excellent care and support for Alzheimer's or dementia, ranging from 70% of Asians to 52% of Blacks. To a lesser extent, Americans also see lack of health insurance coverage, services missing in their community, and a lack of family and community support as likely barriers. Blacks, however, were most likely to perceive racial and ethnic discrimination as a barrier to receiving quality Alzheimer's care, with 36% saying so, compared to 19% of Asians, 18% of Hispanics, 12% of Native Americans, and just 1% of whites. A significant concern among racial and ethnic groups is a perceived lack of empathy from healthcare providers. Just 48% of Blacks feel confident they have access to providers who understand their ethnic or racial background and experiences. That compares with 47% of Native Americans, 49% of Hispanics, and 63% of Asian Americans. Now, Aduhelm, that's the Biogen drug. Medicare recently put forth a draft plan to only cover Aduhelm for patients enrolled in a randomized clinical trial. Biogen, the company behind the drug, and major Alzheimer's patient groups all panned the proposal, saying it would make it harder for vulnerable populations to access the medicine. The Alzheimer's Association called it shocking discrimination. They note that only a limited number of people can enter a clinical trial, and that those clinical trials are likely to occur at major medical institutions, which are more often located in wealthy white areas of the country. Lower income patients, too, might struggle to access the drug if they can't drum up the nearly $30,000 to pay for it out of pocket. There is good reason to highlight these concerns. Black and Hispanic people are significantly more likely to develop Alzheimer's than white people, but are far more often excluded from clinical trials. And even when they can participate, Black individuals were 35% less likely to be diagnosed with Alzheimer's, despite the fact that they are estimated to be twice as likely as white individuals to develop the condition, according to a 2021 study. But Stats spoke to several of the nation's top researchers on the racial disparities in Alzheimer's disease, and they uniformly argued that increasing access to the new therapy would only have a minimal impact on addressing health inequities. Several even praised Medicare's proposal because they said it would help gather needed data on how well Aduhelm works in people of color. Many of us who actively work in inclusive dementia spaces are in broad agreement. Medicare's decision to cover Aduhelm in clinical trials is the best incentive to determine whether it even works in women and people of color. That's from Jonathan Jackson, Executive Director of the Community Access, Recruitment, and Engagement Research Center at Massachusetts General Hospital. He said that regulators absolutely did make the right decision given the lack of representation of people of color in Biogen's original clinical trial. The debate underscores the rift in the Alzheimer's community over the best way to address these persistent inequities. Advocacy organizations see any effort to keep patients waiting for the drug as creating a two-tiered system. But academics, Stats spoke to, felt that advocacy organizations' efforts could be better spent addressing more systemic issues like overcoming the obstacles that keep Black and Brown people out of Alzheimer's clinical trials or from receiving a proper Alzheimer's diagnosis. So this is where we disagree. Okay. I agree with Medicare's stance, and he didn't. I think that if they have to write checks for $25,000, and by the way, did you know that Medicare premiums have gone up for all Medicare patients as a result of this, as they prepare to have to write these $28,000
really?
checks?
No,
absolutely, yeah.
And they brought down the price. It was like $56,000
before, and they magnanimously brought it down to $28,000.
Right. And yeah. I don't get how that works if you have to put up the money and who's got the money to put up? Oh, and you need a PET scan and a diagnosis.
Thank you.
That means in order to qualify for treatment. So that means you have to have a neurologist. Right. You have to get covered for the PET scan, and you have to go through that full neurological evaluation. Right. So you have to have a diagnosis.
Right. And then what if it doesn't work for people of color, right? So far, the drug has not proven that it's working. The buzz really is based on the neurologists who see it, the potential for clearing the amyloid plaque, but it hasn't really proven out so far. You remember we talked about this several weeks ago, and yes. I was marveling.
You don't know whether or not it's amyloid plaque is really the only cause,
Right,
or
exactly.
the cause. And I could see how some neurologists want to take the position, well, I'd like to do something for my patients.
Right, because time is of the
nothing.
essence with a disease
Right.
like Alzheimer's. Like the sooner, the faster you can get, anything going, any type of treatment, the sooner you can beat it back and not have to deal with the deleterious, debilitating.
Right, delay those effects. Yeah.
Right, exactly. So if you can delay it as much as possible, that's what you want to do and get in there early. So I understand the urgency, but it has to work for everybody. And I agree with their stance.
Well, first of all, I want to give kudos to AARP to do such a massive
yes.
and big survey.
Yeah, bravo.
It always seems that surveys in pharma and all this come from pharma. Clinical trials are performed by pharma. So when someone independent comes and does a survey or somebody as credible as AARP, that's a very good thing. So kudos to them to do that. Number two, let's look at the study itself, which is who's worried. I absolutely feel that. I agree with the results. If I was African American, I was faced with a lot of other things, economic disparities and other things that they are more likely to have. I'd be damn worried, because what are they going to do with me? At what point is my family going to give up on me and stick me in a home or put me somewhere else, where if I was with a family with a bit more resources, more means, I'd have more space in the house or have my own house. I would have access to nurses. I would have access to better insurance. So I wouldn't be as worried. The whole survey is, are you concerned? It's not, are you going to get it, but are you concerned about it? So yeah, the poorer you are, or the more underprivileged you are, you're going to be more concerned about this problem. Now that starts leading us down the road is, if you're very concerned about something, sometimes you're going to test less for it. And you're not going to go, and if you don't have insurance, the tests for Alzheimer's are ridiculous. You have to prove beyond a shadow of a doubt that you have all this stuff. They got to take a spinal tap, this and that. Forget about it. Who's going to do that?
Well, also the screening, the initial screening for it is a bit iffy too, because don't they have there's things that you have to, like, they ask you questions and so on and so forth, and you have to be able to answer those questions. So you may very well have early signs of dementia, but you may be able to answer those questions. I remember years ago,
it might be too early to get diagnosed.
Right.
Yeah.
Like I felt like my mom was showing signs of dementia because I'm around her all the time, and
but she didn't necessarily.
But when the doctor asked her particular questions, she was able to answer them clearly. So their criteria for what defines Alzheimer's, I think that needs work as well. But go ahead, back to your point, which, by the way, I'm just going to rat you out a little bit, and say that's not what you were saying when we were having the discussion.
Well, I haven't gotten.
Okay. All right, I'm just going.
I'm giving kudos, I'm saying that
I'm giving you the floor.
We've got a real disparity here, I like to look at what are the causes of disparity and try to head things off at the pass before they the further we let dementia go, the more and more prohibitive it is. Alzheimer is up to now. One of the worst things about it is it really has no cure. And it's kind of like a freight train. Once it gets started, it's going to get there. And there's no stopping it no matter what. So one of the things that we were hearing about was keeping that person mentally agile. Think of it as having them do Sudokus every day or some nonsense, so that they can be engaged. Because one of the things that happens with the aged is they stop working. After that, all their friends die. Or start dying or become retired or drift off. And there's nothing for them to do. There's a lot of other things that are incorporated with the aging: loneliness, quietness, lack of communication,
lack of routine,
all that, or a routine that's basically very sedentary.
Mm-hmm.
Again, money plays into it. If you're more affluent, your family's more affluent, you're going to have more opportunities. You're going to have the opportunity to have a health aide come in. You're going to have the opportunity to have people come in and do things with you. even if it's just to make sure they're on your will, that kind of stuff that happens. So affluence to me, plays a lot into it. The second thing is there's always been a correlation between high blood pressure and Alzheimer's and dementia. They can't prove it, but one thing tends to, people with high blood pressure tend to have the disease a bit more. Again, it's a disease that's much more prevalent amongst people that are poor, A, because of diet, B, because of lack of health care. So if we have all of these things that, if the feeder system is primed, yeah, we're going to get people into that feeder system in terms of where we're going. Now, as for the question.
Yes.
And what the question again? The question is, why should...
No, it wasn't a question. The discussion that you and I had was about Aduhelm and Medicare stance that if we're going to foot this bill, that we're going to foot the bill, your patients, anyone who takes your pill has to be in a clinical trial because we want proof of life. And you felt that was wrong. You and the Alzheimer's Association, maybe not the Alzheimer's, but I forget the other one, felt that this was an outrage. It shouldn't be. They should just pay for it. And I felt like they absolutely should do this because otherwise, the only people this is going to work for are the people who can afford it anyway, and the people who have great insurance, and the people who have connections to get the care. So every person that has Medicare is going to be on the hook, premium wise, for this drug. That's ridiculous. Most people's premiums don't even add up to $28,000 a year, and they're being asked to foot the bill for what could potentially down the road between this coronavirus and all these inflammatory conditions be a blockbuster of people coming up with Alzheimer's in the future. They're going to be on the hook for millions of dollars. And I'm not pro insurance by any means. I'm saying that if they're going to have to shell out this kind of money, we're going to need some proof of life. We're going to need to make sure this works for everybody, not just a small group. That's the question. Tell me why.
Are you taking the position that, look, we've got something that's got potential. Why do we need to stop access for those people who might be able to access it? Is that what you're saying, Lou?
Well, proof of life with Alzheimer's is you got to have it. And, there's a lot of, that you start on that road early. And it's a progressive disease. So the clinical boundary right now for having Alzheimer's is you got to have deep Alzheimer's. You know what I mean? It's not like I'm getting.
But Aduhelm is not made for deep Alzheimer's.
No, it's made for early on. Yeah, just to delay.
So you're not going to. You may not prove positive for it. It's like
there are other types of dementia. You have to make sure it only works for Alzheimer's dementia. There's other dementias, so they have to differentiate between that.
Right. So, once you start having problems, it's very hard to clinically tell what kind of dementia you have. It's only after the disease progresses a bit that you're there. You've got to nip it in the bud. So what you have to do is you have to start making these drugs available to large populations where they have them at. The people with Alzheimer's can be a subset of the trial. But I think that you've got to give this to people at all stages, from stage 0 to stage whatever. Now, the price of the drug is contingent upon how many people are eligible for the drug.
So you think that they're going to drop their price to say 14,000?
That's what
they're going to drop their
the more pills that you can give out at the earlier stage, the cheaper this treatment is going to be. Up until where you get to the point where you're basically paying above compound. Because the way they do it, when you get into pharma pricing, is they're gonna put in their profit. So if you've got a profit, okay,
here we go, Jackie.
A profit, divided over 1,000 doses versus a profit that's being divided over 1 million doses. Let's give out the 1 million doses as long as it doesn't hurt you to take it. I think it's a good thing.
But he's not dealing with the equity problem.
But are we giving out 1 million doses at $28,000 a pop? Is
No,
that
the prices start going down, just like it was 56. It went to 28.
But it wasn't 56 just an inflated. Did they just call out that number? How did they come up with 56,000?
They come up with the number because they start saying, okay, who do I give it to? And when they see that they can't give it to anybody because you got to be like all the way at that stage of Alzheimer's.
Well, you're supposed to be diagnosable at the stage where you're diagnosable, and it needs to be early stage for it to be effective. It won't once you, so they have to determine you're at that particular stage of Alzheimer's.
Well, if you look at it and you say, okay, 6 million people in the United States have Alzheimer's, you multiply that all out throughout the planet, you're talking about a couple of 100 million people have Alzheimer's on this planet.
And the population's aging. It's only going to get to be more people.
Right.
So if you say $28,000 times that, there's not enough money in the world to cover this. Forget about just insurance. There just isn't enough. So the price goes down. The price will go down. But you have to make this a much more inclusive process to get this product.
Oh my God, he's saying something completely different.
Saying it's inclusive, isn't that saying it?
I'm saying everybody should get it. You don't have to be on the damn trial. Just give it to people.
But most people cannot afford that kind of money. First of all, this is being covered by Medicare, not Medicaid. Medicare, which is what? Elderly people, right?
Mm-hmm.
So you have to be over
65 and over. Yeah.
Right. This is not even talking about other insurance companies. And then how early are you really going to find this if this is only paid for by Medicare?
Okay, well, remember, it's a condition that usually only affects retirees.
And let me tell you, my mother couldn't get, what was it? I think it was Part D because she was like 1/4 shy.
Mm-hmm.
Part D is pretty close to Medicaid, isn't it? And Medicaid doesn't cover what Medicare does. Yeah, Part D.
She wasn't able to get the insurance part of it. Wasn't able, I don't know if that's Part D. I know she was able to get like 2 of the parts, and then the third part, which was the insurance part that kicks in after Medicaid, I think, right? Mm-hmm. She was not eligible for that because she was 1/4 shy. So you're probably going to have a lot of people who fall short of that and can't afford it. And my thing is that if they're going to be footing this humongous bill, which by the way, all Medicare people have to pay for with it. So from that pot, everyone is going to be responsible for that. So like, for example, if you're an older person and you don't have issues with Alzheimer's or dementia, guess what? You're still responsible. Your premium is still going up because they've got to figure out how they're going to pay for this stuff. So that's the first thing. The second thing is, how will they know once they start paying all of this out? See, my thing is, I think that insurance does this thing, not insurance, I'm sorry. Pharma does this thing where they get the cream off the top and then they go back afterwards and figure out, oh, well, I guess this didn't work in this instance.
They profit while they can.
And then they go back afterwards after they've already made the money. And maybe
the profits in the
of course the $28,000 is a lot of profit. Don't tell me.
To cover costs.
This is not to just cover costs.
The profit
this is over $2,000 a month.
The profit of this thing. Well, first of all,
and then what's the regimen? And then what's the regimen?
I don't know how long they have left in the patent. That's another.
So it would be a case where I think you'd have to get either intravenously and
that's going to cost money as well because guess what? You have to that person who's putting that needle in your arm, they have to be paid.
Right. You have to go to the neurologist to get it done. So it's every 4 weeks. Yeah, and it's got to be done at hospitals or an infusion therapy center. So it
that adds up. That's on top of the price of the drug.
Well, unless people are taking it now and we have a good number, we're just not going to find out if this thing is effective or not.
But that's why they're saying we want everybody.
Oh, and one of the side effects, by the way, is brain swelling.
Yes.
And a lot of people are arguing that they're concerned that, there's a lot of side effects. And one of them is, brain swelling and dizziness.
Yeah, remember we were talking about, we don't know how this even came to market, how this got approved. Mm-hmm. Yes. Go ahead. You were saying, Jackie?
It's controversial. There's some people who really are not so impressed. Some neurologists want to offer it because they want to be proactive and they want to be able to offer the patient something as opposed to nothing, which is what was there before. Mm-hmm. It's not a drug that has universal praise. and approval, and it's $28,000.
Right, exactly.
I think a lot of this can just be solved with Pfizer sitting themselves down with the room with the Medicaid folks, negotiating a price just for them, and getting it done.
And what do you think that price is? Because you think that 28,000 is the price.
I don't know. I mean, it's whatever it is. At this point, it's 28,000.
Did they throw out 28,000 just to establish a high number so it could be negotiated down even further, but not too low?
They have a formula. Okay. Some of it is based on how much money has gone into developing the drug. Some of it and part of the reason why these drugs are so expensive for Alzheimer's is there's been so many dead ends and so many billions of dollars spent already looking for drugs to cure this thing. And they always wind up being a dead end, that all that money kind of gets put into a pot. And then what they're saying is, okay, I've got to recoup that pot. It's almost like you repairing some old house and putting like $400,000 into this old house. And you pay, let's say you bought it for $200,000. Then you go out there and try to sell it for $600,000 when this house is only really worth $250,000 in the market. But in your mind, I want to get back what I put into it. And that's kind of how the drug companies are saying, we put in so much money into Alzheimer's and into Alzheimer's research, and they're the only ones doing it.
Let's say they're the only ones doing it. I don't think they've benefited all this time. There's plenty of government subsidies, and I recognize they want to make a profit, but we've had this argument before. All right, go ahead, Tim.
Well, I was going to say that I liken this example that you just gave to, I bought a house for $200,000. I fixed this house for $200,000. But I'm going to sell this house for $1 million because I've got to recoup on all the losses from all the other houses.
All the other houses.
That's outrageous. That's not how you price a house. You price a house based on the comparables, and you price a house based on
basic. Comparables, but
that's not what they're even doing. They're not even doing that. Have you ever heard of any other drug that treat Alzheimer's that is even near that price, Jackie?
No, I mean, what I do see is that this is a different class of drugs. So they've made progress there. It's a whole different class of drugs, and that's exciting. Mm-hmm. But it's only a phase 1 trial. It's super controversial. Not everybody's so impressed, other than the fact that this is a new class of drugs, and that's
just hasn't proven itself at this point. And to ask for that kind of money, I think they're right to ask for more data and more diverse data. That's all I'm saying.
This is back to our question, though, of how do we get more diverse data? We need more people to participate in trials.
Yes.
Not everybody. And that's hard to get, right?
That is, yeah. That's the problem.
And part of it is because of the whole diagnosis criteria that, while they have Alzheimer's, did they go through the people that are not as fortunate have the ability to go through all the diagnostics to stay beyond a reasonable doubt.
And do they even get referred up to a neurologist who might be able to tell beyond that initial diagnosis? That's the thing. I don't know that that's really happening across the board.
I think a lot of diagnosis, from what I've seen in my experience, happens at the NP level. They give you some test and they say some word test and they say, oh, this one can't even remember their own name. You got Alzheimer's, and all of a sudden you have it, without having the clinical diagnosis of that. And I'm a little surprised that the Medicare requires that clinical diagnosis. I think that's a big impediment to equity in this drug.
How so?
Who's going to have the money for that? To go get spinal tap, this and that? It's a lot. You got to go through a lot of stuff to get that 100% clinical diagnosis on this in order to be clinically diagnosed with it, where you can see that this condition exists.
I mean, yeah, that's a fair point.
Well, they're saying it only works for Alzheimer's. It doesn't work for all the other dementias. That's what they're saying.
I think it starts with people first need to be referred to a neurologist. People need to first be sent up to a neurologist.
Yeah, it's the neurologist who calls for all those tests. Okay.
Right. And the gatekeeper is, as you said, the NP or the PA or the doctor or the primary care doctor. Those are the frontline people who may or may not. So that So I think the problem then is educating, goes right back to educating these doctors on when in doubt, refer it out. You know,
or,
and then not necessarily
change the
doing
criteria. Change the criteria. I'm not saying lower it, but change it so it's not as onerous. Because when you have an onerous criteria for diagnosis like this,
right,
you're going to really get a whole slew of people that are not going to go through
it's
it,
true,
or not even allowed to go through.
I'll give you an example. It used to be, in order for you to qualify for genetic counseling for a BRCA mutation, you had to have more than one family member, female family member, that had breast cancer. They used to rule out prostate cancer. Then they found out that no, prostate cancer is that same gene. And so once they included prostate, so my mother had breast cancer, my grandfather had prostate cancer, that automatically then meant I was eligible for genetic counseling. But before they made that change, I was not eligible for genetic counseling. And I never would have found out that I carried the BRCA mutation had it not been for that change. You see?
Right. And then once you had that marker, then you were cleared to get more testing more often.
Right, exactly. So to his point about changing the criteria, I think that's a really good point, that the criteria for that needs to be changed, because then that opens the door for a lot more people who have it to be able to get an earlier diagnosis. But that still doesn't address the $28,000 elephant in the room. And we're not going to have to get into that today.
Who wants to make a bet that number is going to come down?
I'm willing to bet that it's going to have to come down, because this is like such an outrage and there's such an outcry that nobody's going to be able to shell out that kind of money. There's no way they're going to be able to approach any kind of equity with that kind of price. That just blew me away. The $56,000 blew me away, and this $28,000 blew me away. But I'm telling you, with the amount of people with all these inflammatory conditions coming up, there's going to be a lot higher number of people. They're going to have to take another look at the criteria so that they can get people in earlier, and empower doctors to make the decision to refer people to neurologists, et cetera. But that's where it's first got to start. So that's all the time we have today, guys. Thank you so much. And I will talk to you next week.
Very good.
All right.
Bye, guys.
All right. Bye.
Thanks for listening to Urban Health Weekly today. I hope you'll join me and my friends next week so you can stay informed and inspired to take control of your health. See you next time.